Hi, Dr. Ian from Lakeview Dental and Wellness. Just shoot a quick video about a case presentation about a patient, lovely patient of ours, and how we do things here. So, patient presented with a deficient top jaw, with flat cheeks, lower jaw in the right position. So, big aesthetic problem, big airway problem. So, uh, the lower jaw is in the right position. So people often think that the lower jaw is too far forward, and we do analysis to see if the lower jaw is in the right position according to the skull base. And we did assess this lower jaw to be in the right position and the top jaw to be deficient backwards. So what we wanted to do is to get that top jaw forward and get the aesthetics better in both the facial and the teeth. So that's the top jaw presenting from the start, and the lower jaw presenting from the start. And that is halfway through treatment, how we managed to get that top jaw forward a little bit. And you can see the difference here in how that jaw comes forward. That's the appliance side view. And we're using the lower jaw as an anchor instead of a face bow external. And he was wearing the lower device at night in bed with elastics to get that top jaw forward. But that's not the only principle we used in this case. That's the front view of our bow, putting traction on the top jaw. This is the appliance on the top jaw. So we're using a few principles. There's some buttons underneath there, putting pressure on the lip to get that bone to come forward. There's also a screw that's expanding there, bringing pressure onto the bone there, getting that to track forward, and then also the hooks here to get traction forward. So that's the lower appliance. That is, we've got this appliance now fully extended to where it can go. So, and now we've locked it in place, and we've got that in there for at least 4 months to just settle the bone. Otherwise we can lose that forward very quickly. It just goes back very quickly. The lower appliance, and that's what we ended up with. So forward displacement of that jaw in a natural process. So we can see how much of forward growth we achieved. So we ended up with a positive forward bite versus the negative there, where there was a negative gap. Now we've got a positive gap. And patient has had facial improvement as well, and just a lot of better biting, a lot better functioning. And there's still growth to happen in this patient. So later on, we'll see about closing gaps and other aesthetics. So at this stage for this young patient, we just wanted to get a better bone position and worry about moving the teeth straighter later on when all their grown-up teeth have come through. And that is the case presentation. Thank you.